After 50 years in government, Dr. Anthony Fauci is leaving public service. Serving under 7 presidents, Dr. Fauci has led the National Institute of Allergy and Infectious Diseases for 38 years. He toiled through everything from the AIDS epidemic when politicians wouldn't even utter the word, to the Ebola outbreak that reached our shores, to the COVID pandemic that left us shuttered in our homes and resulted in the loss of more than 1 million Americans. Earlier this morning, I spoke with Dr. Fauci, director of the National Institute of Allergy and Infectious Diseases and chief medical advisor to President Biden. Dr. Fauci, welcome back to the Sunday Show.
Thank you very much, Jonathan. Good to be with you.
So during your last briefing at the White House, you encouraged Americans to get their booster shots. We've got COVID-19 that's still out there, RSV and the flu, they're all surging. And health officials are concerned about what they're calling a triple-demic, because they share common symptoms. What are the main differences that people should watch out for if they're not feeling well?
We can do things that are very important to mitigate against at least 2 of those. We have a vaccine for influenza. Get your vaccine for flu. COVID, we know the data are very clear of the differences when you're comparing a vaccinated person with someone who is unvaccinated and a vaccinated boosted person with someone who is unvaccinated. The severity of disease leading to hospitalization and deaths are profoundly different. The curves, you don't need to be a statistician to figure it out. The deaths and hospitalization for unvaccinated, the deaths and hospitalizations for vaccinated and boosted. So given the fact that we are having a confluence now of at least three separate diseases that have respiratory components, we can definitely do something about at least 2 of them. And you could also do something about RSV. I mean, if, for example, you're in a situation where someone is coughing or sneezing or has RSV, wash your hands. You kind of forget about, we were talking about washing hands all the time. Respiratory syncytial virus, RSV, is spread by droplets, so that if someone coughs on their hands and then shake hands with you and then you touch your face and your mouth, that's what you've got to be careful of. So there are things you can do for all 3 of those things, and that's what we're encouraging people to do as we're getting into the colder winds of the late fall and the early winter.
Thanks for all the medical advice. Shifting gears, we got to get personal, because this will be probably our last time talking with you as a public servant.
Right.
You've been a public servant for more than 50 years. I want to bring up the documentary Fauci that was on National Geographic. You cried at one point during the interview. You were recounting a story about a patient with AIDS who had gone completely blind.
Right.
And the interviewer asked you why you got so emotional, and you said that it was, post-traumatic stress disorder, plain and simple. Talk more about how your work has affected you personally. You've been through wave after wave of lots of diseases and pandemics and epidemics that have hit this country.
Yeah. Well, what I was referring to, Jonathan, is that if you look at my career starting 54 years ago when I first came to the NIH, I was involved in, thankfully, and I was very fortunate to have been involved in the development of therapies for diseases of inflammatory autoimmune nature, where you have the immune system reacting against its own tissue in a group of diseases called vasculitis. And back in the late 60s and early 70s, I developed effective therapies. So for a brief period, not brief, 9 years or so, my professional career was associated with having a disease that most people died from, that I developed the therapies that put them into very, very high level of remission. So everything was going well. I felt good. People would come in thinking they were going to die. I would do this therapy, which is now standard therapy, and they did well. Then 1981 came, when the first cases of HIV. And from the beginning, when I started taking care of people with HIV, until we had effective therapies several years later, I'm primarily a physician. People who see me on shows like this, that look at a public health official, but I'm a physician and I'm a scientist, and I take care of patients. And back in the early 1980s, the overwhelming amount of my time was taking care of very, very sick patients, mostly young gay men who are otherwise healthy. And when you're in a situation where every day you go in and take care of people who you get to know and you get to like and they depend upon you, and you see every single one of them dying or going to die soon, you have to suppress that. Because even though as a physician you take a very professional, somewhat detached approach to it so that you could function well, you still feel the pain of people suffering and dying, so you suppress it. And the story I told on the film Fauci from National Geographic was we developed a very strong relationship with this patient who was going blind gradually right in front of us until it became very, very clear that he had gone completely blind. So in order to function in the next patient whose room I had to go into, I had to suppress that. So when the interviewer brought it up again, and I did have an emotional response to it, I used the word post-traumatic stress because I think that's what I and many of my colleagues, physicians and nurses who were taking care of persons with HIV back then felt that, because it was a terrible time. As a physician, you're trained to heal people. And when you're put into a situation where you don't have the tools to do anything except comfort people, that becomes very painful.
What do you think, what do you wish you could have done differently in your more than 50 years of public service? If you could change one thing, what would it be?
My goodness. There were so many things that went on. I mean, you always say that maybe you should have responded earlier to something as it was evolving. You know, one of the things going back with HIV, that one of the classic principles of infectious diseases is that you don't give prophylactic medicines to prevent things because you could lead to drug resistance or what have you. So the scientific community early on was reluctant to give prophylaxis antivirals or antibacterials to people who were suffering with HIV because we felt we might do more harm than good. So it took us a little while to realize, you know, put all that other stuff behind you, give them prophylaxis against pneumocystis, against CMV, against anything else. And it turned out that that saved a lot of lives. So if we had to do it over again, we would have been more aggressive to do that in the beginning.
And I thought you were going to, I thought I'd cut you off. But last question, real quickly. Your proudest moment?
Oh, my goodness. There are several because I've had multiple hats. But one of the things that I really feel very good about has indirectly to do with my science background and accomplishments and my administrative competence was to be able to work with President George W. Bush, where he honored me to give me the privilege of tasking me with putting together as one of the architects of the President's Emergency Plan for AIDS Relief, or PEPFAR. And PEPFAR now, 20 years later, has clearly saved approximately 20 million lives. So that's something that I feel very good about. Proud, but also humbled and privileged that the President of the United States, George W. Bush, tasked me with a project that actually saved so many lives.